Good afternoon. Thanks you for coming back for part 2 of our press conference on the TB incident that's happening in El Paso. My name is Robert Resendiz, R-E-S-E-N-D-E-E-S, and I'm the health director for the city of El Paso. I'd like to introduce our panel today. On my immediate right is Eric Evans. He's the CEO of the Sierra Providence Network that runs Providence Memorial Hospital. On his right is Dr. Enrique Martinez. He's the medical director for the hospital. On his right, Dr. Mary Anderson. She's the medical director and regional director for Western Texas for the Texas Department of State Health Services. And with that, we'd like to do some follow-up since we met. I'd also like to excuse our health authority, Dr. Hector Alcaranza. He wasn't available to be with us today. And we'll have some Spanish one-on-ones afterwards to accommodate those who need that. Okay, so on Friday, 9/19, we had our press conference here. I think it went very well. It generated a lot of calls a little earlier than we had anticipated. So on that very day, Friday as well as Saturday and Sunday, we started booking patients, many of which we saw yesterday. I'll get you those numbers in a second. As of close of business yesterday, we fielded over 880 phone calls, and through today, from about half an hour ago, we're over 1,000 phone calls that we've handled. On Monday, we're going to start slowly to make sure we get this right and that the nurses learn the paperwork and the computer systems and those types of things. So we scheduled 40 patients, and despite the really bad weather that we had yesterday, 38 were able to keep their appointments. We got the bugs working out, so we double booked for today, and we scheduled 80 patients, and by 4:30 p.m. we've seen 72. So we've had a really good run. We think we can do better, so we're going to try to up it to 100 to 120 patients a day tomorrow. And what that'll do is we originally figured it's going to take about 6 weeks to see all these kids. We're shrinking that down to 3 weeks so we can get that done much quicker. For some reason, at the state level, our 211 system crashed this morning, and that made it difficult for a lot of people calling in. That's fixed now, but we still like people to use 211 system if they have questions or if they need to make an appointment. And we've also, just in case, computers, once they go down, sometimes they can go down again real quickly. We've set up a new phone number for people to call in. In addition to the 211, that would be 915-771-1228. Some other updates. We requested assistance from the CDC. They've got expertise and they handle these types of things on a daily basis. We will see this probably once in a lifetime. So they will arrive on Monday. And our state public health partners, not from El Paso, but the ones from Austin, should be arriving on Tuesday. One of the things we'd like to make clear is we're really tightly scheduled. We have 80 patients to see today. We're going to shoot for 100 to 120. We really need to work by appointments only. We've had some people showing up without appointments, hoping to sneak in as a walk-in, and the waits could be extremely long. You could theoretically be here for 10 hours and not get seen if you arrive first thing in the morning. We really need to give those who have appointments their appointments, and showing up without an appointment will mess up the whole schedule. We should be able to see everyone within the first 3 weeks. TB is not a disease that if you wait a week or 2 weeks, that things are going to go really bad. TB is a really slow-growing disease. If you're first on the list or last on the list, it's not going to make that much of a difference. As of 2:30 today, of the 700 plus patients that we've identified, we've made appointments for 502 of them. So we're well on our way of making this happen. We've been working closely with our partners in Mexico and New Mexico. They're seeing patients already as well and doing the testing that's required. Tomorrow here at our shop, the dispensing of medications appropriate for this type of exposure begins. Let me be clear, just because someone's getting medication does not mean they're sick. We're just taking away the risk, and we're going to be treating all babies the same. All babies under 6 months old will be given the medication. Yesterday, or through the weekend, we discovered about an extra 50 babies or so that were off of the original list. The reason that happened, most babies are in the nursery. They're in those little plastic cradles, if you will, and some of them are under the lights if they're jaundiced. The hospital's billing system, tracking system, did us right by the babies who weren't jaundiced. The jaundiced babies were missed, but we picked those up over the weekend. appointments are already being made. In fact, our first 2 patients yesterday that I got to meet with were some of the missed jaundice babies, so we're already taking care of those. There have been rumors out there that I think it was 10 babies have tested positive. That's impossible because we haven't even gotten the results. We started the testing. It takes 48 to 72 hours, but we inject some protein under the skin on the baby. So we did that Monday and Tuesday. Those tests will not be even read until tomorrow. So if anybody's saying there's positive babies out there, that's incorrect. And lastly, we sent certified letters out, regular letters out. We got, I'm thinking, about 30 of them back. So we're following up on that so we can get a hold of those folks. Some people have moved out of state. We've already contacted other states and other territories, and the patient as well, so they can get their public health treatment, screening, medication if necessary in those other states. The public health network in the United States is really robust. We have really good communications one with another. Somebody moves, we know where they are, and we pass that along. We do that with Mexico as well. So with that, I will have each of our panelists speak, then we'll answer a couple of frequently asked questions that we've been getting from parents in the last 2 days, and then we'll open up to questions. Thank you.
Good afternoon. My name is Eric Evans. I'm blessed to serve as the CEO of the Sierra Providence Health Network and directly as the Chief Executive Officer of Providence Memorial Hospital. I first of all want to apologize to the families that are affected by this and to let you know that as CEO of Providence Memorial Hospital, I and my colleagues take absolutely full ownership of our role in this and making sure that we get this right. I represent today over 3,000 dedicated coworkers who get up every day dedicated to helping others in their most vulnerable moments. They're a group of people that I'm very proud of, and they're all struggling with this having happened in our facility. As many of you know, Providence has been proudly serving this community for over 60 years. We've taken care of probably many folks in this room. We're interwoven in the fabric of what Providence, or what the El Paso community is, and I'm very proud of that. But I will tell you, no matter how positive the early signs look, no matter what happens, no amount of risk that is unnecessary in our hospital should ever happen, and we take absolutely full ownership for that. With that said, I also want to tell you, I've been in El Paso now for 2 years. I came here with a newborn baby who's now 2. I have a 4-year-old as well. Heading to China in a month, roughly, to pick up a 3rd child. Family is everything to me. In my 2 years here, I can honestly tell you we've become part of El Paso. It's a community that you can quickly bond with, and many of these folks that have been affected are my friends, my family, and they're my community. We will absolutely do the right thing for all these patients. I also want to make clear this is not something that we're putting back on the city. We are staffing, we are screening, we are supporting this in every way, and we will continue to make this right. It's absolutely something we take ownership of. We're going to make this right. We're going to work hard with the community. We've had great partnership. I'm very, very happy with how well we've been working together. But this is something that we're going to work through, and our absolute commitment is to come out of this with an even stronger healthcare system here in El Paso. Thank you for your time.
Good afternoon. My name is Enrique Martinez. I'm the Chief Medical Officer of the Providence Memorial Hospital. Let me start by saying that we share an unwavering commitment to do everything we can to ensure the health and continued well-being of our patients, our employees, and our community. Our top priority is the health and safety of our patients and our employees. In cases like this one, typically a few exposed patients will test positive for the exposure. And as long as we identify them early, they can be easily and effectively treated and cured. According to national data, babies who test positive for TB exposure and are treated appropriately with antibiotics have an almost 0 chance of developing active tuberculosis. Fortunately, the treatment that is offered also has minimal side effects. We know that there's a lot of anxiety and angst in the community, and this exposure should not have happened, as Mr. Eric Evans, our CEO, has just stated. We will take full responsibility for it, screen all the patients that need to be screened, treat those few patients that convert to positive, and our commitment to this community will continue. Thank you.
Good afternoon. I am Dr. Mary Anderson, and I am the Regional Medical Director for the Department of State Health Services for the state of Texas. And I would like to emphasize the fact that we are here to support both the El Paso City Health Department as well as Providence in this investigation. And what we have done is provided personnel who are experts in record keeping and the documentation that's required for this very large event, which involves much paperwork, as you might imagine, as well as providing an individual who is an expert in tuberculosis case detection. And we certainly will cooperate and provide additional assets and resources as the needs are identified. But once again, I think the most important thing is that the state of Texas, El Paso City Health Department, and Providence Hospital are all joined together as a team in this effort to make certain that we clarify all the questions, find all of the patients, and do the right thing for each and every one. Thank you.
You know, in a way, we're somewhat fortunate to be in Texas. Most of the TB cases in the United States are in Texas and California, so we've got that expertise just based on the numbers and the experiences that we have. In terms of frequently asked questions that we're seeing from the patients and parents coming in, many of them, what's going to happen? When I make my appointment and I show up at the health department, what's going to happen? Let me walk you through this, and for those of you with the cameras, when we're done, if all our patients have cleared out, we'll let you go see our clinic and take some images of that. So upon arriving, there's a check-in procedure, and then while waiting to see the nurse, there's a health educator available, there's a video going, there's a time for questions and answers. Once in the room, there's more education that takes place. The child is injected with a little bit of we call it PPD. It's a protein that mimics tuberculosis, and that needs to incubate in the arm for 2 or 3 days, and then everybody's going to come back on day 2 or day 3 to have that read. If they've been making the best use of their time, they will have gone with a voucher provided by Providence Memorial Hospital to the hospital, had an x-ray, had that x-ray read. So by the time they come back, we have the x-ray results, we can read the results in their arm, and we can make a preliminary diagnosis and share that with physicians. And I need to emphasize that all this is done at no charge to the patient, thanks in large part to the generosity of Providence Memorial Hospital. The other one I was going to mention is some parents are coming in and they're nervous, especially our newer parents, first-time parents, and some of the other parents, even if they're not new, they're bringing siblings in tow and family members in tow, hoping for everybody to get treated. I want to reemphasize something we've said from day one. Infants who may happen to be infected with tuberculosis cannot transmit that to anyone else, not to mom, not to dad, not to the siblings. So any fear there is somewhat unjustified, and we need to keep educating and reminding people that even though a baby may be infected, and I want to stress may, they are not infectious. They keep it to themselves, they don't share it with others. And so, again, if you did receive a letter from the health department, that's somewhat the golden ticket that you will show up and we will work with you. If you have not received a letter, that's because you didn't qualify or you're not, it's not necessary for you to be tested. So with that, we got a couple more questions. I'm going to have Dr. Martinez answer that, and then we'll open up to questions.
One of the questions that is coming up is my baby okay? You know, my baby was at the hospital when this employee had active tuberculosis. And now there's a lot of anxiety and a lot of fear from the families and the parents about whether my baby is okay. And I just stated a few minutes ago that studies have shown that as long as we get to the babies, screen them and take care of them as indicated by guidelines and recommendations, that they will be okay. And then if they need to get the medicine that they need for the exposure, like I said, there's almost a 0% chance that they will develop any active disease. Another question that has come up is, can my baby make my brother sick if they sleep in the same room? And the answer that we are getting from the experts, from pediatricians, from infectious disease experts, is that no, your baby cannot make his brother or any member of the family sick.
Go.
Hi, it's Juan Carlos Dorca with the Associated Press. One thing that we'd like to understand is, I talked to several parents today, and they didn't understand what was a year, a long time for this person to actually spread or be in contact with children. I understand that CDC says that testing should be done 3 months prior of the first symptoms. So if that person had symptoms as early as December, January, what happened between then and August 2017?
So I'll answer that question because I can understand exactly why that would raise a lot of questions. I can tell you this, that the first time Providence was aware of any symptoms was in July. And one thing that I will go ahead and share from you, because I know you guys have all seen this on the front page of the paper, we are having, as we would expect in this type of situation, we are having lots of cooperation with regulatory agencies to make sure that everything is safe. I will tell you that the first time we were aware of any symptoms was in July. You will see, and I will tell you this as well, we have submitted a robust action plan today. We will make that public as soon as it's accepted by CMS. We expect that to be relatively quickly. You'll see exactly what they found and what we said. We did know of some symptoms in July that we should have done more with. You'll see it in the plan. We'll talk about that. In August, when this employee, before we had confirmation that they had active tuberculosis, they were on leave. But there was certainly no awareness of anything in our health system before July. And there's lots of reasons we can talk about that. The folks here can talk about this with more expertise than I can, although I'll tell you, this has been a lesson in tuberculosis for myself. Many people in this city and many people in this region would test positive for latent tuberculosis. And many of those people could have symptoms, if keeping this broad, could have symptoms like a cold or a cough or things that wouldn't necessarily lead a doctor or someone to a diagnosis. And so what I would tell you is we knew of some symptoms in July. We could and should have done more at that point. We'll talk about that in our process. The December timeframe was something that was not in our knowledge, and certainly in hindsight, when the Department of Health looks back across a long record, there's obviously things they can see that we didn't have. Yes, sir?
But you do conduct yearly.
Absolutely. And that was in July when we had the yearly screen where there were symptoms, and more could have been done there, and we'll talk about that.
And before that?
Before that, it would have been the prior year, right? So.
July 2013, yeah.
Right. And so at that point, there were no symptoms, and the screening was done appropriately. So the point is, and I think an analogy, and again, we could have done more in July, but an analogy I would use, and that we've talked about a little bit, is if you get your car certified, that it works perfectly, and the next day you get your windshield cracked, it no longer passes that inspection, but you've got the sticker, right? I think we were going to look at that. I think it's a real question. Nationally, that's the process people follow. It's a robust process. We had some opportunities with what happened in July, but the other time frame it's a question that we have to work with our community to make sure we learn from. Not just us, I will tell you, I have been in contact with my colleagues at other health systems, because what I'm absolutely committed to is whatever we learn out of this, the whole community needs to learn. This isn't just us. We need to make sure everyone learns from these opportunities. But that's the answer. And you're going to see a robust action plan. We're going to post it publicly. You're going to see exactly what those deficiencies were that have been talked about that are related to this case. And you'll see specifically those actions and what we plan to do.
Mr. Evans, Ashley Rodriguez with ABC7.
Yes,
What
ma'am.
about the prospective loss of funding because of this?
Yeah, and so that's absolutely tied to this regulatory review, and rightfully so. When regulatory agencies see something like this happen, where there's an exposure, there's a lot of concern, and there should be. What I can tell you is this. We believe we have a very comprehensive action plan. We believe that the steps we have taken make our hospital safe. We expect, fully anticipate that CMS will accept our action plan. They're going to come back and make sure we're doing it. They're going to come back and check to verify for everyone in this room everything that we know about Providence for the past 60 years. But the answer is that we take it extremely seriously, obviously. We have a robust action plan. We've taken actions, and we feel good about where that is. And we look forward to having CMS come back and work with us to make sure you all feel the same way.
So is so is the protocol for detecting active TB in healthcare workers once a year?
Yes, it's a typical screening across the country is an annual screening with healthcare workers, absolutely.
And then what are the safeguards if they get active TB and TB tested?
Sure. So there's broad different types of responsibility on this. Obviously, the employee has some responsibility. Certainly, that's part of the education. The medical community, when you think about this, the medical community, the treating physicians have some responsibility. All of us in between those times, because as you can imagine, there's always a practical limit to how far you can go with testing. You can test somebody every day, you can test somebody every month. The evidence over time has led to the annual testing being what that balance is. But with that balance, the one thing that I want to make sure this is an opportunity for El Paso to learn about is TB. With that balance, we have to have very, very active education amongst our physicians, active education amongst our employees, and this more than anything else points that out. It's a real opportunity for us to be smarter about TB going forward. Great question.
Question for Mr. Resendez. The side effects of the medication in young babies, they're minimal. Can you talk about that?
They are, but since I'm not a physician, I want to turn that over to someone who's better qualified to answer that.
You guys can run this.
And also x-rays. Can you talk about the risks? As I understand it, babies under 6 months shouldn't be exposed to x-rays too much.
Okay, with respect to tuberculosis prophylaxis medication for babies, I'm not a pediatrician and I'm not an infectious disease expert, but we have consulted them. We have consulted pediatricians, we have consulted infectious disease experts, and what they are telling us is that in babies who are treated with the medication, when they have exposure, that this is extremely safe, that they do very well, that the side effects are minimal. This is the information that we are given. As you may know, when you look at any medication, whether it's Tylenol, whether it's aspirin, whether it's a TB medication, there's a huge list of potential side effects that anybody may have. So any medication will have that long list. But in terms of actually what we see on patients getting the medication, the pediatricians and infectious disease people tell us that the side effects are very minimal in these patients. With respect to radiology testing for babies, I think the chest X-ray radiation dose is very low, very minimal. We're not talking about a CAT scan that has 1,000 times or hundreds of times more radiation than a chest X-ray. So the X-ray that is done to screen for this has a low radiation, so it's not really one of those high radiation tests.
Oh, excuse me, sir. Once we have you here. It was mentioned that babies under 6 months will be given the treatment. Did I hear that correctly?
Yes.
Why is that, and why that 6-month mark?
I should have gone to medical school. My mother would have been proud of me today. So, just so you know, with every decision we're making, we're not pulling numbers out of a hat or how to do this. We're working very closely with the CDC. I've got like a 50-page document here, and we can share that with you. I think we want to post that on our website. It's the CDC protocol for treating and handling people who've been exposed to tuberculosis. So we're going by the book on this. So as we test these babies, chances are they'll test negative the first time. We start treating them anyway, because what we want to do is make sure that no baby falls between the cracks. If you don't have TB and we treat you, you took some free medicine for 3 months, and at the end you test negative, and you're free to go, so to speak. If we perchance do have a baby, and I hope we don't, who maybe tested that we treat, and at the end of that 3-month period they test positive, then they did have an exposure, and we will likely extend that treatment for another 3 months. The baby's over 6 months, they're kind of out of the danger zone, if you will. Nothing's happened, they're already 6 months old. We will test them, do a chest x-ray, all negative, all done.
Mr. Resendez?
Yes, ma'am.
Are we making any progress on trying to find patient zero? Is there such a thing in the case of tuberculosis? And could the hospital worker have contracted the TB as a result of having a latent case of it, or even from another patient in Providence?
I think you asked this on Friday, didn't you? Or something similar.
Several days have elapsed.
Chances are, no. She could have picked this up years ago, many years ago, and it laid dormant, if you will, and for some reason it came to life in the last year. We seldom find long time, where did they get this from? I will share with you this. I lived in Brazil for a couple of years, came home, I tested positive. I've taken the medicine for 6 months. There's maybe other people here, there's definitely people in our community who they pick it up and we may never know where. I don't know where I got it in Brazil. I spent a lot of time with different people. I came home with a souvenir I hadn't expected, followed the protocol, I've had no problem since. So, and by the way, part of that, it would be interesting to find out where she picked it up from, but it wouldn't help our babies today. So we want to concentrate on our babies. I'm sorry?
Help other babies or other
Well, hopefully whoever she got it from has already been found out and treated. If it's 2 years, and then another 2 years, another 2 years, hopefully they've gotten that. I think somebody was ahead of you to the right. Yes, sir, behind you?
Yeah, are you confident that you've identified all of the babies that have been potentially exposed?
Pretty confident. This is a big number. We went from about 700 to 750 over the weekend. Yeah, when there's a large investigation like this, the numbers can fluctuate a little bit. So if we had a big 700 announcement and then a 50, we may have little 2 or 3 announcements after the fact, but I think we're to the point that we're at the end of the notification process.
And that employee that's on leave, are they expected back to work anytime soon?
The employee cannot come back until the employee is cleared by the health department that the employee is not infectious anymore.
What did the employee do?
I'm sorry?
Describe.
Yes, I can answer that. So I can't answer this a bit because one thing I will clear up, that it's been reported that the employee is a nurse. They're actually a patient care tech. They're a patient care tech. It's basically, it's somebody who helps nurses, but it's not a nurse.
I have a question here. It's regarding the 211 service.
Yes, sir.
We had a parent today
I won't answer
that is waiting. Whenever you call to 211, you have to wait around like 20 minutes, asking you just questions like yes or no questions. After they ask her for the information of the baby that was born during this period in this hospital, they sent her to a representative. The representative answered him and then hang up. Are we doing something in making a better service, on the phone numbers? I know that you gave us a new phone number.
Yeah, we gave you a third phone number. So you have
Third phone number.
211.
Is this specifically for this type of problem?
TB only, just for this. The 211 menu, if you will, it's cumbersome. So on Friday, we were telling people, if you don't want to listen to the message, and we've all used these voicemail things, dial 211, 11, and that'll get you through quicker without having to answer those intermediate questions. Like I said, in the last 4 days, we've handled over 1,000 phone calls. There may be an oops now and again, but for the most part, we have over 500 people scheduled for their appointments. It's generally working well. There'll always be an oops, if I can say that. Hold on, we got one in the back.
A quick question. 211's program manager is here and is asking that we clarify who it is that is getting the treatment. We keep hearing the phrase all babies, but in fact it's all babies that are part of this list, not all babies that were at the hospital.
That's a good,
Well,
thank
maybe
you.
it was part of that list.
In this case, yeah. But we can't reemphasize enough. You know, we spent a lot of time looking at, with our experts, what was the right group to look at. You know, and it's not even all babies on a particular day, it's down to a shift level, right? So to be very clear on this, just because, and this is a little confusing because we've been very transparent, right? We've had the posted what days the person worked, but a little detail on that posting is the shift they worked. And there are people that could have the same date of delivery, but yet not have been necessarily need to be on this list. So this is why it's so important. If you haven't been contacted, then you're not in that list. And so just wanted to reiterate that, because I do think it's creating a lot of unnecessary angst.
What about those that were born on the day, but that's not highlighted, but they stayed until the day that's highlighted? Well, why aren't they on this list?
Well, I think the way this list was selected, obviously we worked very closely about who would have been exposed, and the thought is the person that was born that day would have been the most likely person to have any contact with the baby. And so if it wasn't born that day, it might have been there a different day, the decision was made that that wasn't in the screening risk group.
So if you can imagine for the hospital, they have to cross-reference the employee's work schedule against what babies were there, and these are two moving targets, and they have to do this for a whole year. And it's a tough thing.
That's why it took so many days from August 27, when the test results came back, until mid.
Well, I think there's a couple things there, you know. So there's a very specific process you go through when this is done. I will tell you, when the person first went on leave, we didn't have a confirmed case. Okay, so we had some tests that were out. We knew the first step in this process was going through all the employees, because that was the closest immediate, right? So we followed a process, a checklist, very much by CDC protocols. That took some time, and then certainly as we started to gain more knowledge, then we went through the next process. And yes, part of it is getting the data right, and certainly part of it was the initial protocol based on what we knew.
And the day we got that list, the letters went out. We were ready. We knew it was coming. We prepared everything so that when so that when it did arrive, we could go. So there was some advanced preparation waiting for the list, and as soon as it hit, the list went. Just like these extra 50 or so babies over the weekend. We got the list Monday morning, Monday afternoon, the letters went out.
Were all the parents notified of by phone or mail?
We sent certified mail to every parent. Not everybody likes to get certified mail, so just in case, we sent uncertified mail to every parent. And some of those letters are coming back as undeliverable, and we've got people contacting them by phone now. Those that we can't find by phone, I think we've already had some cases where we're going into the neighborhoods and saying, you know so-and-so who lived here. So
Okay, because this parent has not received mail or phone calls, and it's part of the list. So, this is kind of scary for the parents, you know, because the baby's part of the list, and
What list?
of the list that you gave, like,
We didn't pass out any baby
well, I mean,
lists.
when not the baby list, but the baby that was born on the dates that are in yellow.
So a key thing here, they could have been born on the dates in yellow and not on the shift this worker worked. So as far as on the list, just because they were born on a particular day doesn't mean they're on the list.
The baby was in the hospital for 8 days.
Right, but again, so the way, to be very clear, and this is getting very technical because we had a lot of advice from medical experts, we pulled any baby that was born on the day this person was working is on this list. If they were born after that, say this worker, I think it's a day shift worker, so born in the evening, would not be on this list, not considered to be on the exposure. Oh yeah, and there's also, you know, one thing too that I should point out, just as a technicality, just to, I guess, ease some people's minds. In particular, a baby that might be there that long was probably in the NICU. If they were in the NICU, not exposed at all. So any baby that was actually in the NICU, completely different area, there's no exposure. And that baby, they being there 8 days, my guess is that baby was in the NICU, not the nursery.
And do you have test results for the 40 workers?
We do. So we have tested, and actually we've tested more workers because, as you can imagine, as the employees thought about this, I have lunch with this person. I have, so I think we have tested 55. To give you the exact results, we've had 55 people are identified. 53 have been tested. There's 2 that we're still waiting because they've been out on FMLA, and so we will make sure those get done. Of those 53, we've had no active TB cases, so everyone's been cleared, nobody's infectious. There were 2 people who hadn't prior been latent that showed up as latent. They were cleared beyond that, no symptoms. Again, hard to know, you know, with those 2, but certainly the good news is out of those people that were closer, there's no active TB, no one was infectious, they've all been clearly checked.
Mr. Evans, can you explain why parents and other children in the family should be tested? I know the babies can't really transmit it,
Sure.
but do they not have any contact with the patient care techs?
Yeah, so I think the way our experts looked at this, and the state physicians, and again, I'm not a physician, so I'm going to answer this and let Dr. Martinez make sure I don't step out of line, but I've obviously spent a lot of time listening. What I would say is that as you know, TB is A, not easy to catch, B, this person would not have had much interaction with many folks except in the nursery, is my understanding. And so the general consensus was from the adult side and even on the family side, that just, it didn't warrant the actual going and testing. And so they really focused on where might there be a risk. We try to be very broad, and to go back and talk about the length of time, again, I can tell you when we knew about symptoms, but they went back, broadly, talked to lots of people, and they said, well, gosh, it could have been as early as December, January. Went back another 3 months, right? So if you think about that list of time, they went broad with that group that they thought was the right group to target. And then we take the experts' advice on this, that we had a lot of epidemiologists involved. They've given us great advice, and we're following them.
And so the techs stay in the nursery, they don't go in and out of patient rooms?
The techs are not always in the nursery, but the patient, the techs are not always in the nursery, but the interaction level that's required, the kind of the time frames, the closeness, was determined to be that was where the risk was.
Exactly. I think the key point about exposure is how long you have the exposure. Because as you're pointing out, an employee can go throughout the hospital, but the risk of infection or transmission of tuberculosis is when there are several hours of exposure, not that you passed by. That's not how this typically occurs.
Could we please answer some questions in Spanish, for Spanish speakers? What would be our...
Do we
Dr.
have any
Martinez.
other questions in English, and then we can open it up to Spanish if y'all don't mind doing that?
One last one. Why are we sending letters to Mexico, considering the mail system there will take you 2 weeks to a month to get a letter, if at all sometimes, because all the mail first goes to Mexico City, and then from Mexico City it goes to the assigned cities like Juarez. What are we doing to make sure that those families do get notification? We've already run into some of them.
We're getting lots of calls from Mexico, so at least many people are getting those letters, and they're calling in here. We have public health partners on that side. They have the list of who the Mexican families are, and they're taking over the investigation on that side of the border. The ones who have gotten their letters, we've communicated that to them. The international letters, I don't think any have bounced back yet. That could take a long time, obviously, but we have that in place to take care of those families. Good question.
Any other questions in English?
There's
Okay,
no...
we can keep it quiet if anybody's going to break down, but we need to answer the questions in Spanish. And Mr. Gonzalez, Fernando Gonzalez, is our lead epidemiologist, will field some of those questions on behalf of the department. And Dr. Martinez, I believe, will answer questions in Spanish.
Perfecto. Si nos puede dar primero que todo un repaso de lo que han dicho hasta el momento, para empezar por ahí.
Buenas tardes. Mi nombre es Enrique Martínez y soy el director médico del Hospital Providencia. Primero, queremos disculparnos con los pacientes y la comunidad por haber expuesto a pacientes en el Hospital Providencia a un paciente que tenía tuberculosis. Tomamos la completa responsabilidad de lo que pasó en nuestro hospital y vamos a repararlo, vamos a corregirlo, vamos a contactar a todos los pacientes, a checarlos y darles el tratamiento apropiado, y lo tomamos 100% como nuestra responsabilidad. Como parte de un sistema de salud de más de 3.000 empleados, no solo sentimos mal porque nosotros tenemos este caso, sino porque tenemos 3.000 empleados, más de 3.000 empleados, excelentes, que hacen trabajo excelente todos los días y están pasándonos por esto ahora que es duro para los pacientes y la comunidad. Nuestro jefe del hospital, Eric Evans, explicó que él tiene niños pequeños y él sabe exactamente la ansiedad y el temor que hay cuando estos casos ocurren. Pero afortunadamente sabemos que cuando se exponen a niños, a una persona con tuberculosis, se puede prevenir la enfermedad, se puede curar, la mayoría no van a tener la enfermedad, va a ser un número muy pequeño que sea afectado, pero dándoles el medicamento estamos bastante seguros que los podemos curar.
¿Usted diría que lo que se está haciendo hasta el momento es una medicación preventiva?
Ahora todo es preventivo, porque no sabemos de ningún caso de algún empleado o algún paciente que tenga tuberculosis por haber estado expuesto a este empleado. Todo es preventivo ahora.
¿Qué se está haciendo del lado mexicano?
Bueno, el Departamento de Salud está trabajando con las autoridades de Juárez y del lado de México y también del estado de Nuevo México. Ellos tienen buena comunicación y están coordinando que a los pacientes que estuvieron en nuestro hospital se les contacten, también vengan a hacerles chequeos y les den el tratamiento apropiado.
¿Y qué se está haciendo dentro del hospital para prevenir que vuelva a suceder algo como esto?
Buena pregunta. Nuestro jefe Eric Evans habló ahora y les explicó que probablemente mañana el plan de corrección que se va a someter al gobierno va a estar visible probablemente en el internet. Ya lo mandamos hoy mismo, este plan de corrección al gobierno. Estamos colaborando con ellos 100% para asegurarnos de que estemos haciendo lo correcto y más de lo correcto y más de lo recomendado.
¿Qué nos puede decir usted de la persona infecciosa, de la persona que en algún momento dio positivo a tuberculosis, de la trabajadora?
No le puedo decir casi nada porque esa información es privada.
Pero nos puede decir, como nos dijeron en inglés, que es una persona que no era una enfermera, más bien una técnica que no ha regresado a trabajar. ¿Nos puede decir más o menos lo que se dice en inglés?
Pues sí, se dijo que es una asistente de enfermería y no ha trabajado desde antes que se le diagnosticara tuberculosis.
Doctor Martínez, tengo una pregunta. Se dice que es una enfermedad que no avanza rápido, avanza lentamente y que realmente el tiempo no hace diferencia. Sin embargo, tenemos padres desesperados que están llamando al 211 de servicios, tratando de buscar ayuda. ¿Y cómo el Hospital Providence detectó a los bebés? ¿Cómo asegurar que esta persona no tuvo contacto con ninguno de estos pequeños?
Bueno, creo que hizo como 2 o 3 preguntas ahí, pero primero, el hospital ha trabajado muy fuertemente con las autoridades del Departamento de Salud para identificar los pacientes expuestos y afectados. Es un proceso complicado, toma tiempo. Como Mr. Reséndez explicó, estamos bastante seguros que ya la mayoría de la gente expuesta se ha identificado y se está contactando. ¿Qué más me preguntó?
Prácticamente le pregunté cómo asegurarse que esta persona, o sea, cómo se detectaron a los más de 750 bebés, cómo se aseguraron que esta persona no tuvo contacto con más, cómo llegaron a ese número de 750.
Bueno, el proceso es que hay ciencia para todo esto, ¿verdad? No es un proceso que se ha inventado, hay recomendaciones del gobierno, recomendaciones científicas, y está basado en qué tanto tiempo se estuvo expuesto a la persona afectada. O sea, no porque uno pasó por el paciente o vio al paciente se tiene que chequear, tiene que ser un contacto de varias horas o más, varios días, no solamente que vio al paciente y por eso ahora tiene que ser checado.
Cuando hablamos de esta persona afectada, siendo una técnica, ella, ¿qué hacía ella con los bebés? ¿Le daba medicina? ¿Le daba comida? ¿Qué interacción tenía ella con los bebés?
Ella trabajaba como asistente de enfermería y es todo tipo de trabajo y no le puedo decir los detalles exactamente de eso.
¿Cómo le va a afectar al hospital este caso en cuanto a los fondos federales que se otorgan?
Pues estamos trabajando con el gobierno ahora, las autoridades, para que ellos vengan a repasar todo lo que estamos haciendo. Ellos tienen que estar seguros que estamos haciendo un buen plan de corrección, que estamos tomando todas las medidas posibles para que esto no suceda de nuevo. Ahora estamos en peligro de perder esos fondos federales, por eso ellos van a visitar probablemente a nuestro hospital en los próximos días. Con mucho gusto estamos aquí para trabajar con ellos y hacer todo lo posible para que el hospital esté seguro para la gente.
Se podría decir que fue negligencia por parte del hospital el haber tenido a esta persona trabajando por tanto periodo y sobre todo un trabajo pues, bastante delicado porque estaba en contacto con recién nacidos.
Bueno, lo que hizo o no hizo el hospital va a estar en el plan de corrección que ustedes van a ver próximamente, que se sometió al gobierno. El hospital sí tiene responsabilidad parcialmente de lo que ha pasado, como explicó nuestro presidente, pero nosotros no supimos de que este paciente tenía tuberculosis hasta mediados, fines de agosto. O sea que información de que nosotros supiéramos que el paciente tenía tuberculosis no fue hasta mediados o fines de agosto, por lo tanto no podíamos tomar medidas antes de ese tiempo.
¿Fue negligencia o no, doctor?
Esa pregunta no se la puedo contestar.
Gracias.
¿Cuál es el mensaje hoy para los padres que tan desesperadamente están buscando ayuda para sus niños?
Pues gracias por darnos la oportunidad de hablar con ellos. Estamos aquí para asegurarles que si se chequean, si se presentan para que le atiendan a su bebé, estamos bastante seguros que su bebé va a estar bien, que le van a dar la medicina apropiada. Estos casos han ocurrido. Afortunadamente sabemos que cuando han ocurrido, en general, si se hace todo bien, no hay complicaciones, no hay infecciones. Así que siguiendo las recomendaciones, ellos van a estar bien.
Quisiera que me dijera en español lo que decían ahorita. O sea, el niño pudo nacer ese año, pero hay muchos puntos que no hay por qué alertarse. Si la persona no estaba en ese horario, o sea, no exactamente debe de ser el niño que nació ese año, tiene que estar perjudicado. ¿Me podría decir todo eso en español? Del cubículo y todo eso.
Dígame exactamente lo que quiere saber.
Nada más que me diga que los padres de familia no tienen que estar alertados si no les llega la carta. Vaya.
Bueno, el proceso que se ha seguido con las autoridades del Departamento de Salud es identificar los pacientes que pudieron tener más contacto con el empleado afectado. Y siguiendo esas recomendaciones de ellos, nosotros estamos contactando a esos pacientes. Como hemos dicho, si otros pacientes tuvieron contacto con este paciente por un tiempo leve, no se recomienda generalmente que se le hagan los chequeos. Así que estamos haciendo lo que se recomienda.
Volviendo a lo de la línea de tiempo esta lo que dijo fue que ustedes tuvieron conocimiento de síntomas la primera vez en julio. Si nos pudiera describir un poco cómo tienen ustedes conocimiento de estos síntomas, qué pasa, la persona va con algún médico de ustedes, expresa los síntomas, y luego qué pasa entre julio y 17 de agosto que esta persona recibe el examen de test.
Bueno, como se explicó en inglés, el empleado tuvo su chequeo anual en julio y es cuando presentó ciertos síntomas que pudieron haber sido tomados como algo así.
Pero cuando dicen chequeo no es que le hagan una prueba de tuberculosis, sino es nada más un cuestionario sobre...
Es el chequeo anual que se le hace a todos los empleados para ver que no tengan enfermedades contagiosas, para checar de no tener tuberculosis, es lo que se hizo.
¿Pero se le hace la prueba esta de la piel?
Para pacientes que ya tienen lo que le llaman el latent tuberculosis, si ya tuvieron la prueba positiva antes, ya nada más se les hace un cuestionario y las preguntas de síntomas. Si tienen síntomas, hay recomendaciones que tienen que seguir. Si nunca han tenido el chequeo positivo, Entonces sí tienen que hacerle de nuevo el chequeo de la piel para ver si tienen el estudio positivo contra el tuberculosis.
¿Y a esta persona se le hizo en julio de este año la prueba?
Ok, esta persona pasó por ese proceso. No quiero decirles si esta persona tenía o no tenía el latent TB, como le dicen antes, porque eso es información del paciente.
Pero esta persona no estaba enferma, no es una persona que tenía síntomas, que estaba enferma y que fue a quejarse porque se sentía mal. Y de ahí descubrieron que tenía tuberculosis.
Mire, como dijeron antes, lo que pasó entre el paciente y su doctor es información que no podemos comunicar y no es información que nosotros tenemos, porque es información privada del paciente con su doctor.
Fue julio de este año, ¿verdad?
Sí.
Ok, pero no queda claro si se descubre durante un examen rutinario que se le hace todos los años o se descubre durante una cita que esta persona hace por quejas de cualquier enfermedad. Eso es lo que no queda claro.
Bueno, lo que nosotros hacemos es el chequeo anual a los pacientes. ¿Okay? Lo que un empleado hace con su doctor está entre su doctor y el paciente. ¿Okay? No es una cosa que yo le puedo comunicar a usted.
Pero anteriormente nos ha dicho que se descubre en julio durante el examen rutinario que se le hace a los empleados. ¿Es correcto?
Correcto.
We have some follow-up questions in English. If there's no other questions in Spanish, we turn it back. Again, there won't be any one-on-ones offered.
Gracias, doctor.
In order to maintain a unified message and everybody gets the same information at the same time. So, Ashley, with ABC 7, did you have a follow-up?
Just for clarification, the nurse who was initially, she had active TB, you had said that
Was
she-
not a nurse, patient care tech.
You had said she might have had it for years, but it was latent or dormant. So my question is, why did the test detect it?
So,
Let me see.
yeah, please.
I think I said in Spanish, I'll say it in English so people can hear this. In terms of the patient's previous status with respect to tuberculosis, I don't think that I can tell you that kind of information because it's confidential information. Sorry.
With that said, I think I would say that there's confusion, I think, about latent and active TB. As we mentioned earlier, and as Robert shared, he has latent TB. So if he were to test every year, he would test positive for TB, but he's perfectly fine to be around you. No symptoms, no nothing. He may never have symptoms. He's tested positive a long time ago. Many, many people do every year. And so I do want to be clear on there's a very big difference between having latent TB, having a positive, and actually being at all contagious or having any symptoms. It's a very important thing for the community to realize. Obviously, once you have latent, and we're not talking about any particular patient here or any particular person, once you have latent TB, then you may go and never have symptoms, or you may have symptoms. What's tricky, I think, with latent TB, what I learn more about all the time, is when you have latent TB, you may have a symptom. For example, you could be in the winter and have a cold. Do you have TB? Probably not your first guess if you've been latent for 10 years, right? And so, it is a process that's kind of interesting with TB that's unique in some ways to TB, but that's a confusion because I think people would say, well, gosh, they tested positive for TB. Many, many people do in our community as far as exposure. And then there's a whole difference between that and actually having an active TB case. So.
And when you're cured, is it eradicated or is it just go latent?
Okay, so that's beyond my medical knowledge, so I will, sorry.
No, when you're cured, it's gone.
Okay.
Sir, I just want to confirm, all babies 6 months and under are scheduled for the appointment to come in, get tested, look at the meds? And the 6 months and older, if only they show up on the...
So the 6 month and older, they'll have the skin test, and then they'll have an X-ray, and if those are both clear, they're done.
Okay, thank you.
So, and regarding urine screening, if someone in the past tested positive for latent,
Yes.
then that person would not be tested against repeatedly over the next years because that person has already tested positive, right?
Correct, yes and no. So what would happen is, what's the typical procedure is, if someone has latent TB, and again, we're talking about anyone, anyone has latent TB in a hospital setting, they would have a follow-up questionnaire. So they'd have an initial chest x-ray to make sure they're clear and have no symptoms. And then every year, they would still have the test, and they'd show up positive every year. It'd be expected. They've been tested, right? And then every year, they would watch for symptoms at that point. Because really, people, I mean, many of these people, they're in the room. They've been fine for years. And obviously, you wouldn't continue to do test after test if there's no symptoms.
Again, we're talking about
Yes.
all people in general.
All people.
But a person tests positive, and then there's a questionnaire, a screening about symptoms.
Sure.
And
And that determines what happens.
That said,
Yep.
move back to July this year. This person was screened.
Right.
She mentioned some symptoms, but they were not taken as possibly TB at the time.
Yeah, so let's put it this way, it wasn't identified at the time. There were opportunities, and you'll see this in our action plan. I think that, and I'll leave it at that. I mean, there were opportunities.
And what happened between that screening and when she eventually actually got tested? Did she get worse and decide to...
Again, unfortunately, I can't get into specifics of what treatment she might have got, what things she had happen. I really can't talk about that. We've already kind of covered what we can.
Mr. Evans, where are you getting the 700 plus testing kits?
Where are we getting the testing kits themselves? I'll let the health department talk to that. Sure, let me find out.
They're not kits per se. We have very small needles, which moms like and the babies appreciate. And the protein that we inject right under the skin, they come in little vials about this big, and you can do 10 patients, 10 babies out of that little vial. So this kit for 700 people is about this big, shoebox. We got this.
Is it common for this many patients to be exposed to TB from just one person who has it?
You know, if you Google TB nursery hospital, you'll see situations like this have happened very recently in Los Angeles. I think they're in about the 500 range. Last year, Las Vegas had one. It was in the 100 and a little bit range. So there's been big ones. We're just a little bit bigger. So.
Patient zero.
I could be.
That's what they took from
If there's no other questions, we'll go ahead outside to Suite C and